Thank you, Dr. Leffler. That was a fantastic talk, going through Vienna and the life of Karl Steiner, really rich and full of a lot of information. For the sake of time, we're going to skip questions until our second speaker presents. And I was thinking how to connect, the history of Karl Steiner through the next talk, which is coming. But then Dr. Leffler just mentioned Dr. Jacob Arnheim. So I said, oh, that's perfect, because he connects it to Arnheim-Chester disease and the histiocytosis. So our next topic is going to be the history and evolution of Rosai-Dorfman disease. And it's going to be presented by Dr. Mariko Yabe. Dr. Yabe was born in Tokyo, Japan, and graduated from Keio University School of Medicine in Tokyo. She worked as a hematology-oncology physician for a couple of years in Tokyo, and then immigrated to the United States. So she's been a clinician in the past. Dr. Yabe did her APCP residency at Mount Sinai St. Luke Roosevelt Hospital in New York City, and followed by a hematopathology fellowship at MD Anderson, where we both met and became very good friends. And since 2016, she is working at Memorial Sloan Kettering Cancer Center as an attending hematopathologist, and works in the field of hematopathology, including multiple specimens in this specialty. Plus, she is a member of the histiocytosis disease management team. She signs out cases of histiocytosis from the histiocytosis clinic from Sloan Kettering Cancer Center, where there is a really big group of research and clinical research in histiocytosis and clinical trials. So, Dr. Yabe, it's a pleasure to have you here. And again, the topic of your talk, History of Rosai-Dorfman Disease, attributed to Dr. Juan Rossi, very pertinent since he just passed away a couple of years ago. Thank you for being here.
Thank you, Sergio, for the introduction. And first, I would like to thank the History of Pathology Society to give me this opportunity. Do you hear me? Okay. Okay. Like this? Yeah. Okay, thank you. So first, I would like to thank the History of Pathology Society for giving me this opportunity. I have nothing to disclose. It is unusual, but I'd like to start with the reference because I never met Dr. Rosai, and I don't know him in person. But because Dr. Rosai was chair of pathology department at Memorial Sloan Kettering Cancer Center, where I work currently, between 1991 through 1999. So I have colleagues who worked with Dr. Rosai. Also, I have colleagues who was trained by him. So I was able to get some information from the current faculties at Memorial Sloan Kettering Cancer Center, as well as I was able to get some photos and information from these three journals. One is special articles published in AJSP by Dr. Klimustra and Dr. Young after the passing of Dr. Rosai. And we have MSK Pathology Review magazine, and one on the left side was published after the passing of Dr. Rosai. And also there was an issue focusing on the MSK chairman in this magazine, these articles, and Dr. Rosai was the sixth chair of the at the pathology department at MSK. And I added Kojo because this was published before Kojo joined us. So today's talk is largely based on these three papers and also the information I got from current attendings at MSK. And all the photos are either from these three papers, or I got some from Dr. Victor Reuter and Dr. Mark Rosenblum at MSK, and also I got some photos from photo image inventory at MSK. So, of course, Dr. Rosai is famous for Rosai-Dorfman disease, but I would like to emphasize that Rosai-Dorfman disease is not the only contribution he made. So, his paper remained at the benchmark contribution to the pathology of these tumors for many, many years. And these examples include from bone and soft tissue pathology, GU, GI, hempath, and thoracic, and all broad field of pathology. And among these, perhaps the most notable research contributions were the novel entities that he described. One is sinus histiocytosis with massive lymphadenopathy, which is a Rosai-Dorfman disease, and another is desmoplastic small round cell tumor. In addition, he trained many pathologists. He was a mentor of many pathologists who pursued academic careers in the US as well as Latin America and Europe, all over the world. And he was he was a fantastic person, a lover of opera and soccer. Also, he was a great speaker and writer. And surprisingly, he gave a lecture at 2000 US CAP meeting, and he looked at the future of pathology in 21st century, and he already foreshadowed the impact of molecular and digital pathology in 2000. Year 2000. And the left side photo, I took this photo from the website of the History of Pathology Society. And this is the Dr. Rosai's collection, already digitized in 2009. And luckily, we still can see his collection with this website, www.rosaicollection.org. So he knew that this digital pathology era was coming. So now we are moving on to the biography of Dr. Juan Rosai. He was born in 1940 in a small village in Tuscany. And when he was 8 years old, he and his family emigrated to Buenos Aires, Argentina. And when he was born, his name was actually Giovanni. But Giovanni became Juan when he moved to Argentina. And he retained this name for the rest of his life. And why did he decide to pursue medical career? So when he was 13 years old, he had a bicycle accident and he fractured his femur. And he had so many complications and he needed to have a couple of operations, and he had to stay in the hospital for quite a long time. And this experience stimulated him to consider a medical career. And surprisingly, at the age of 15, he enrolled the medical school at the University of Buenos Aires, and he graduated when he was 21 years old. And during his medical school, he met the pathologist, Dr. Eduardo Lascano, who gave him a lifelong influence. And after he graduated, he did a residency training in anatomic pathology under the direction of Dr. Lascano at the University of Buenos Aires. Then he is going to move to the US. So Dr. Rosai met Dr. Loren Ackerman. Everybody knows Dr. Loren Ackerman, who is a father of surgical pathology in the US. So he was visiting in Buenos Aires and he met Dr. Rosai. And Dr. Ackerman offered a training position under his direction. And Dr. Rosai was proposed to take a residency position at Barnes Hospital, Washington University in St. Louis. And he took this position, he moved to the US, and he did 1 year residency and another year as a fellow. And he joined the faculty when he was 27 years old at the Barnes Hospital, Washington University in St. Louis. Then later he promoted to associate professor when he was 33. So these years he worked with Dr. Loren Ackerman. And this is a very famous pathology textbook, so I'm sure everybody knows. But with Dr. Ackerman, he published the textbook Surgical Pathology. And he first joined when they published 5th edition in 1974. And also with Dr. Ackerman, he published series of review articles called The Pathology of Tumors in 1971. And this review covered all the field of pathology from cytopathology to gross description, frozen section, and bone and soft tissue, and also the staging of classification of tumors. The right lower side is a table that he summarized the classification of lymphoma. So he worked in all the field of pathology, and he published multiple review articles with Dr. Ackerman. And then Dr. Rosai left St. Louis, and he did 1 year of research at NIH. And after spending 1 year at NIH, he was offered a professor and director of anatomic pathology position at the University of Minnesota. So he decided to move to Minnesota when he was 34 years old. And when he was in Minnesota, he spent a year doing his sabbatical in 2 institutions in Italy. One is in University of Bologna, another is University of Florence. And during that sabbatical year, he met his wife, Dr. Maria Luisa Carcangio. And after he again went back to the US, and he decided to leave Minnesota in 1985. And he joined to Yale University in New Haven as the director of anatomic pathology. And at this time, his wife, Dr. Carcangio, also joined the faculty at Yale University. Then he decided to move to New York. And so after spending 6 years at Yale University, he decided to move to New York. And then he became the chair of pathology at Memorial Sloan Kettering Cancer Center in New York. And this is the right upper photo is his consult suite. So he's working with multi-head, and behind there are many his collections and of slides and articles. And the lower photo is, this is a private photo I got from Dr. Reuter. So he and his wife. And I would like to show one photo, left side. This is, this photo is amazing, including many legendary pathologists. And I believe, I couldn't find when this photo was taken, but I believe this photo was taken in 1991 when Dr. Alias Stella, 6 from the left, Dr. Alias Stella received Fred Stewart Award at MSKCC. And I think this was the photo of one of the photos at that ceremony. And this photo includes all the legendary pathologists, like Dr. Patricia Saigo for cytopathology, and next to her, Dr. Rosai and Dr. Alias Stella in the middle, Dr. Paul Peter Rosen, and these are the people Dr. Rosai worked when he was at Memorial Sloan Kettering Cancer Center. And on the right side, this is a private photo taken at the department holiday party in 1993. And this Santa Claus is actually a Dr. Mark Rosenbaum, who is the far right side of the left photo. So Dr. Mark Rosenbaum is wearing the costume of Santa Claus and giving a gift as a secret Santa to Dr. Rosai. And actually, there is a little boy behind, and this boy is actually Dr. Rosenbaum's son, Michael, when he was 7 years old. And I got this private photo from Dr. Rosenbaum. Then, after spending 8 years at MSK and total 35 years in the US, he decided to go back to Italy, where he was originally from. So he left MSK in 1999, and he moved to Milan. And he got the chairman position at the Department of Pathology at National Tumor Institute. And later in 2005, he decided to move to a different institution in Milan. But unfortunately, from this time, he started having a couple of his health issues. And unfortunately, his consult practice and academic activities were forced to decline due to his health issues. And he passed away in Milan, Italy, on July 7th, 2020, at the age of 79, after the battle with long illness. And he is survived by his wife, Dr. Maria Luisa Carcangiu, and his 3 sons and his 4 grandchildren. And I was also told that last year, unfortunately, Dr. Maria Luisa Carcangiu also passed away. Then now, the last part, we'd like to move on to the disease, Rosai-Dorfman disease. So when we talk about Rosai-Dorfman disease, we need to know who Dr. Dorfman is. And Dr. Ronald Dorfman, he was born in Johannesburg, South Africa, and he emigrated to the United States in 1963. And he had kind of similar story with Dr. Rosai. So he worked as a faculty at Barnes Hospital, Washington University in St. Louis, invited by Dr. Lauren Ackerman. So when Dr. Rosai was doing fellowship and residency and fellowship at Barnes Hospital in St. Louis, Dr. Dorfman was there as a faculty. And in 1968, Dr. Dorfman moved to Stanford University, and he stayed in Stanford for a long time. And he was one of the founders of the society. He's one of the founder of the field of hematopathology, and he founded the Society of Hematopathology in 1981, and was a president of Society of Hematopathology in 1982. Through 1984. So he was a founder of this field, hematopathology. And one day, when Dr. Dorfman was working in his office at Barnes Hospital, surgical pathology fellow Juan Rossi visited his office, having the slides of 2 weird histiocyte cases, which Dr. Rossi identified in the collection of the cases at Barnes Hospital. Those cases both were diagnosed with malignant reticuloendotheliosis. And Dr. Rosai and Dr. Dorfman were looking at the slides, and those were the 2 cases, both a 7-month-old baby. One is boy, one is girl, and presented enlarged neck lymph adenopathy. And Dr. Dorfman had similar cases, 2 similar cases in his collection from Johannesburg, South Africa. And Dr. Rosai also did a literature review, and he found additional 2 cases showing very similar morphology and clinical presentation. And I was able to find one case report which he found when he was doing literature review, which was the right side. This is a New England Journal of Medicine published in 1966. And this case was reported as histiocytosis, report of an unusual case. And this microscopic photo shows nice emperipoiesis, and he found similar cases. And Dr. Dorfman and Dr. Rosai decided to write up, including 4 cases. 2 cases they found at the Barnes Hospital, additional 2 cases from Dr. Dorfman's collection from Johannesburg, and they wrote up a case series, sinus histiocytosis with massive lymph adenopathy. And unfortunately, I couldn't get the PDF of this paper, but thanks to Sergio, I was able to get the photos of this paper. So this is a case series published in 1969, including 4 cases, 2 7-month-old baby cases, and 2 cases from South Africa. And there is a photo of 9-year-old boy showing bilateral neck lymph adenopathy. And the right side photo shows microscopic photo shows empalipolysis. And this paper was the first in a long series of publication. Later, this disease was called Rosai-Dorfman disease. But you may see the name Rosai-Dorfman-Destombe disease because because 4 years before this paper was published, 4 years prior to this study, actually there was a case series written by French pathologist Dr. Destombe describing adenitis with lipid excess. So retrospectively, those two are most likely the same disease. So when we read some books or papers, including WHO or most recent WHO 5th beta version, also uses Rosai-Dorfman-Destombe disease as acceptable nomenclature. And not only writing this case report, Dr. Rosai created a registry to collect cases from pathologists. And this registry made it easy to further work up to characterize the morphology and clinical presentation of this disease. So what is Rosai-Dorfman disease? I don't think I need to present to this audience, but what we know from Dr. Rosai's registry is, at the time, this disease is more commonly seen in younger generation and more frequent in African population. And typical presentation, most common presentation is bilateral neck adenopathy, sometimes with these symptoms. And nodal presentation is common, but also extranodal involvement can be seen, including skin, bone, soft tissue, etc., etc. And often self-limited, and outcome is relatively good. And right side photo shows, as photo shows, morphology is very characteristic. So we see empalipolysis. And at that time, with Dr. Rosai's registry, they already know that these atypical cells express PAM macrophage antigens. We no longer use those antibodies, but at that time, they already know that these cells express macrophage antigens and also S100, which is still a hallmark of immunohistochemical workup for Rosai-Dorfman in current, still now. And then after Dr. Rosai's registry, what has been advancing in this field? So for a long time, we didn't know if this entity is either reactive or a viral infection or autoimmune. But most of the studies were done with Erdheim-Chester disease and Langerhans histiocytosis. But in 2012, BRAF mutation was discovered and followed by other recurrent mutations in histiocytosis. So now we know that histiocytosis, mostly with Erdheim-Chester disease and Langerhans histiocytosis studies, but we know that there is recurrent activating mutations in MAPK or PI3K signaling pathways. So this finding supports that this entity is actually a clonal process, clonal disease. Then what about Rosai-Dorfman disease? So in 2016-17, it has been reported that Rosai-Dorfman disease also has activating MAPK pathway mutations. One report shows MAP2K1, ARAF, another shows KRAS, MAP2K1 mutations. So these findings also support that Rosai-Dorfman disease is also a clonal disease. But this next slide, this one is actually a bit old study, 5 years ago from our institution. So the case N is smaller. Now we have more cases, but interestingly, for Erdheim-Chester disease and Langerhans histiocytosis, most frequent mutation is BRAF V600E mutation. But this mutation is not present in Rosai-Dorfman disease. Rosai-Dorfman disease have other MAPK activating mutation, but not BRAF mutations. In addition, almost half of the Rosai-Dorfman disease doesn't have mutation. So once we submit for molecular study, the result comes back as wild type. But we believe this is not because Rosai-Dorfman disease doesn't have mutation, but because the case has so many admixed reactive normal lymphocytes or plasma cells. So most likely, because of the presence of those reactive cells, mutation is obscured and we cannot detect with molecular study. So what kind of immunohistochemistry do we use recently? So we still use, as you know, S100 as a gold standard, as Dr. Rosai found from his registry. And now we have some couple of better antibodies for macrophage histiocyte lineage cells. For example, PU1 is this is a nuclear stain, so sometimes it's easier to detect the cells. And also we now know that OCT2, which is a transcription factor for B lymphocytes. So this OCT2 is aberrantly expressed in Rosai-Dorfman disease. And also now we know that cyclin D1 or PARC immunohistochemistry shows a bright positive expression, and those indicate the MAPK activation. So these immunohistochemistry are used for the diagnosis of Rosai-Dorfman, but still the gold standard is morphology and periporesis plus S100. And then good news about this entity is because now we know that this disease has activating mutation in MAPK signaling, and there are some systemic refractory Rosai-Dorfman disease which patient has to struggle a lot. But now we have, because now we know the mutation, so we have targeted therapy for this entity. So this is an example of MAP2K mutated Rosai-Dorfman disease. And patient had significant soft tissue lesion involvement and dural involvement, as you see on these photos, highlighted with yellow circle and arrows. And then after the patient was administered MEK inhibitor, which blocks the MAPK signaling, the patient showed a response. So the soft tissue lesion shrunk and dural lesion disappeared. So now we have targeted therapy thanks to the advance of molecular analysis. And another interesting case is this is a cutaneous Rosai-Dorfman disease. And we tested many times, but we couldn't detect mutation. All the time, NGS comes back as no abnormal, no mutation. And we even did the RNA-seq to detect fusion gene, but which was negative. But because, as you see, the left side, IHC is S100, but compared to the Rosai-Dorfman cells, there are so many admixed reactive normal polytypic plasma cells. So we thought most likely the patient has mutation, but we cannot detect by NGS. So the patient was administered a MEK inhibitor, the same targeted therapy, without knowing where the patient has mutation. And actually it worked. So this is supporting that the patient is very likely having a mutation in MAPK pathway. So now we have those targeted therapy thanks to the advanced molecular techniques. And the summary is Dr. Juan Rossi was one of the greatest surgical pathologists in 20th century. And he's, of course, well known for Rosai-Dorfman disease, but this is not the entity he worked. And he has so many publications, so many contributions to all different fields of surgical pathology. And in addition, he was a mentor of so many academic pathologists all over the world. And the last summary, unfortunately, Dr. Rosai, I don't think he knows about this, but recently the advanced molecular genetic found the upregulating mutation in MAPK signaling. So now this elucidated the clonal nature of Rosai-Dorfman disease, and now we have targeted therapy for this field. So thank you very much for your attention.
Thank you.